session. I would like to ask Akiko to go ahead and introduce herself.
Thank you. Thank you very much, Hamza, and to the TUFH Secretariat for your support. My name is Akiko Maeda. I'm a Japanese and a health economist, and I used to work with the World Bank, but I'm now living in Canada and working with the TUFH Network. So it's a great pleasure to welcome all of you to this series on aging society. Today's topic will be on the use of technology, its application in the elderly care. And I've tried to look at it from different perspectives, how to make elderly care more efficient and less costly. It's one of the issues because it is such an expensive kind of care. And in my own country, in Japan, it is a huge concern. So what are the ways it could perhaps reduce cost? But perhaps more importantly, what can we do to improve the experience of the elderly? And then, of course, how can we make it easier, better for the care providers themselves? So my presentation will talk about those issues. And I'll catch up with you on the other side of the video. So Hamza, would you like to go ahead? Greetings, my name is Akiko Maeda, and today I'd like to speak to you briefly on the topic of how technology is being used to address many challenges facing an aging society, and also briefly about the skills that are required to harness such technologies effectively. The aging society and technology is a huge topic, and in 10-15 minutes, I can only touch upon key issues. So I'd like to start by dividing those issues into three categories. The first and most commonly addressed issue is about the use of technology to solve resource constraints. As many of you know, aging society means higher costs of medical care, of nursing care, long-term care, and social services. And so governments around the world are concerned about how to sustain such high costs through the use of technology. Many countries with aging population also face a declining size of workforce, so fewer active, healthy young workers to take care of the elderly. And so technology is expected to address some of those problems. The second area where technology is being deployed is to support the aging persons themselves to maintain an independent lifestyle, to be able to live with dignity and with autonomy, and how to address the challenges that come with social isolation, loss of mobility, and declining health. So how can technology help these people live a meaningful life? And the third area relates to helping the health workers as well as other care providers to maintain a safe working environment and to make sure that they are not overloaded and to avoid many of the burnout issues facing healthcare workers around the world. So today I would like to focus mainly on the second and the third points, but they collectively also, of course, address the resource constraints when they are implemented together. The graph on the chart, the right, so shows data from the United States, which just gives you some idea of the resource constraints facing even a very rich country like the United States, and the declining labor force available to care for the elderly. And so this issue is even constraining some of the richest countries around the world, and the problem for the lower income countries will be even more acute in the near future. So first, how can technology be used to support the aging individuals and their families and communities? The graphic on the left side shows 5 areas where technology is expected to provide solutions and are increasingly being utilized to do that. And one has to do with access to care services. So how can we provide easier access to healthcare and other forms of services through technology? And this may happen through telemedicine and better appointment system and other ways in which to facilitate access to care. A second and important area is the design of housing itself to ensure independent living, to design homes that are safe and can alert the rest, the care providers and others in case of incidents like fall or a heart attack and so forth. So housing itself is an important area where technology is ensuring individuals to live an independent life as long as possible. The third area, which is increasingly becoming a subject of research for the application of technology, is in cognition related to dementia, mental health issues. How can we apply technology to reduce the burden of those suffering from dementia? And then how can we also make their lives easier? The fourth area is an area that is very much discussed these days, having to do with maintaining social connection and communication. In many higher income countries, in industrialized countries, and in urban areas of lower middle income countries, the elderly are increasingly living in more isolated lifestyles. The extended family structure is breaking down. And so they need to have better ways in which they can stay connected with their loved ones. And technology could be utilized to address those issues. And then finally, we have the challenge of personal mobility and transportation. How can technology help the elderly population maintain access to medical services and other through transport infrastructure and other means of maintaining connections? So these are all interrelated, and the types of technology that are being harnessed is increasing. There is an enormous amount of innovations that are happening, and I've listed a few. We start with remote sensing and monitoring, which is often associated with the IoT, Internet of Things devices. These are wearable devices that people can use to monitor their physical location. That could be used, for example, to monitor a fall and or the heart conditions in terms of heart rates. So it is a very important part of a growing industry in the application of technology. Second area, of course, everyone knows that information technology plays a key role. And as we become more connected with broadbands that can allow much more sophisticated connectivity, and availability of information becomes richer and vast, big data and others become accessible. This is a very important and growing area where technology is being harnessed to deal with the aging phenomenon. Related to that, of course, is social media. The role of social media is huge, at least where they are available. And they are also increasingly being used through research and other means to understand and to identify solutions for the aging society. An area that is perhaps used only in some countries and not yet perhaps as widely used is robotics. I come from Japan, and robotics is certainly playing a huge role in many of our long-term care facilities, which I'll discuss and give examples later. An area that may not be so obvious to individuals and the public, but the use of big data and artificial intelligence is certainly a rapidly expanding area where a lot of solutions are being developed. And as many of you know, it also has implications on privacy and security. And we have to be very mindful and careful of these issues as the application of these capabilities are expanded. And then finally, as I mentioned earlier, the transportation infrastructure is being reformed and revised. New investments are being made, for example, driverless cars. But there are other ways in which the whole transportation infrastructure is being redesigned to meet the needs of the aging population. I wanted to give show this slide on the affirmation of the rights of aging. This is a working document of the United Nations where, as we have with human rights and with child's rights, the principles related to the rights of aging is being articulated. And these have to do with the right to personal autonomy and independence. As we lose our faculty, both physical and mental, how do we protect the right to be autonomous, to live independently? How do we maintain the rights for legal capacity when these rights are being infringed upon? And then the right to have support in ensuring all these rights, other rights, autonomy, dignity, independence, through such means as access to services, being able to make life plans, make living arrangements, and to participate in community life. These are critical aspects that are important to underpin the technology that are being developed. So it's important that we pay attention to these legal aspects as well as the ethical aspects of independent living, and that they have to be woven in to the technological advances. So giving some example of independent living, technology now is being used certainly in higher income countries quite widely, for example, in preventing falls, which is one of the most common ways in which elderly end up with injuries and with life-threatening health problems. So the Internet of Things are now being widely used. That can be connected to a remote sensoring and monitoring network, and they allow, in case of a fall, for the call centers to be used to alert a care provider to come and take care of the individual who may have fallen. This is also happening with heart monitors in case there are arrhythmia or some irregularities in heart that can be alerted. And this is part of a broader design of smart homes that can help those with dementia to live in a safe environment, which helps them to maintain their daily living with minimal support. So this is an important part of what is happening in many of the higher income countries. But of course, this assumes the availability of infrastructure such as the internet, broadband, and so forth, and the resources for the management and maintenance of such complex systems and the human resources to run it. So this is something that is happening in higher income countries. The question is, how do we provide such services at a low cost in lower and middle income countries? Another area for elderly care is in the way that technology is deployed to reduce the burden on the care professionals and the family care providers. And so these pictures are from Japan, where these various technologies are being deployed in nursing homes. They include like robotic nursing, ambient assisted living, so the whole living area has technology to assist the individuals as well as care providers. And you see here an example of what looks like a white bear, teddy bear, that does all the heavy lifting of elderly from their wheelchairs to the bed. You see another robot that is leading an aerobics exercise for the elderly, so that it reduces the burden of having to do this routinely for the care providers. And we also have a picture of what looks like a white baby seal, but it's a robot that is meant to provide social assistance. It is designed specifically to help the elderly with mental health issues or those who are withdrawn, unable or interested in communicating with humans, these fuzzy, warm, baby-like faces seems to trigger an emotional connections that adult humans may not do. And these seal-like babies are used to ensure that the emotional life of the elderly are maintained and to help them open up to communications. Now, the dogs can also play this role, but in a nursing home, maintaining hygiene and maintaining a puppy dog in the midst of a nursing home can be quite challenging. So increasingly, long-term care facilities are turning to these robotics. Of course, they're not cheap and they're not easily accessible for lower income settings. So this is an issue. But I wanted to show you that it's not just physical support, but also emotional support, where these robots are providing very important support measures. Now, I wanted to speak briefly about the application of technology to support the health workers themselves. I've already given an example in the previous slide about the physical support. As you know, having to lift the patients in and out of the bed, in and out of wheelchairs is extremely stressful to the backs of nurses and care professionals. And certainly in the United States, the Occupational Safety and Health Agency notes that nursing is one of the most high risk in terms of back injuries due to heavy lifting. And having some kind of robotic technological support to reduce that kind of strain is known to be extremely important in maintaining the health and well-being of these valuable health professionals. Another area that technology is being utilized much more frequently and widely is in task automation. A lot of the work being done by the care providers often involve administrative tasks, which can be quite onerous and stressful. So by having computers and machine learning to take on a lot of these dull routine tasks can be very important in relieving these valuable health professionals' time towards care as opposed to administrative duties. And so this is certainly becoming much more common, and it is less complex in terms of the application of technology. The third area where technology is being used is in diagnostic support. Many of you may have heard about Babylon and other artificial intelligence type of a program that helps to diagnose radiology images, complex image review. And by training these artificial intelligence programs to review thousands and thousands of images, radiographic images, they can be taught to a certain level almost to be close to an expert capacity to identify anomalies and potential risks. And this is certainly an important area for the aging. These are also being used to identify dementia and Alzheimer's disease, to see patterns, to detect them as early as possible. So this is another important area. Of course, telemedicine is certainly a growing area, and various forms of telemedicines are being developed, and it relies on multiple forms of technology. And right now, as we're recording during this time of coronavirus pandemic, telemedicine is certainly gaining much greater use throughout the world. And finally, I'd like to mention precision medicine. This is a very new area that is growing rapidly. I don't have much time to speak about it, but it really is using the availability of data on genetics, epigenetics, as well as microbiomes, to be able to find and customize treatment for that individual, because we're learning more and more that the average ways in which we diagnose and treat patients are not adequate. There's huge individual variations in how individuals respond to treatments, whether it's drug treatment or other interventions, and a better understanding will certainly refine and improve the quality of care. But this is, again, a new area which requires a lot of resources, a lot of data, and is still in early developmental phase. So again, there's a whole range of technology that is being deployed to assist health workers do their work better, but it does come at a considerable cost, and it also has risks of potential privacy and security leakages. And we have to think carefully about the regulations and the ethical aspects of how we apply these new kinds of technology. But certainly they will be helping more and more the health workers to do their jobs better and with less strain on their backs. I wanted to make sure that I mention the challenges, the particular challenges that aging societies face in the instances of natural disasters or pandemics and other kinds of shocks to the society, to the environment. And we all know that elderly are particularly vulnerable. For example, residents with dementia might become more disoriented during a natural disaster and will require more staff time and resources in order to help them with evacuations and so forth. Of course, physical movement will often require also assistive devices. There may be no electricity. How do you get patients or elderly from the long-term care down the stairs when the electricity is no longer available? We've had these issues in Japan after the earthquake and so forth, and evacuation was certainly a very challenging issue. Once they are evacuated and they are in temporary shelters, the elderly also require particular special attention. And this has been certainly a lesson after the 2011 earthquake and tsunami in Japan, where one of the areas that got highlighted was the importance of dental health and ability to masticulate, which connected with their mental well-being as well as physical well-being. And so there were teams of dental specialists who went around to ensure that the elderly were chewing and able to continue chewing in the midst of living in a very difficult situations in shelters and so forth. And of course, we are now living through the lockdowns in many countries, and the need for support and protection during a pandemic of getting groceries and so forth to various elderly population who are isolated. Now, these are some of the aspects where we're finding, for example, online grocery shopping and delivery through these remote shopping is becoming important. And there are many other aspects that certainly through this pandemic we will all be learning. But it's an area where technology has potential to do more, but I think that we have not yet fully looked into the possibilities, and we hope that there will be much more deeper research and thinking and strategic thinking that will go into this topic. So now I'd like to come to the last section of my talk, which is about the implications for the health workers when we start to deploy these new technologies. So what are the skills implications for harnessing technology? Well, it's evident that the use of technology is not just about handling devices, but also about being able to do complex problem solving. The adaptive problem solving skills will be much more important than before. It is not just rote learning of massive amounts of data, but how do we use those data as a team to solve complex problems? And increasingly, we have to deal with information technology, IT, computers, and to deal with telemedicine, which will become part of the standard basic skills required to harness technology. And another area that has come to light is the ability to understand the wider implications of your actions, that you don't get too narrowly focused on technology on its own, but to understand, have a systems awareness and be able to link back to understanding the complex interactions, and it circles back to adaptive problem solving skills. So these are some of the skills that will become increasingly important for healthcare workers as we face aging society and the need for applying these new technologies in solving many challenges that we face. Another area that has come to light is the importance of interpersonal skills. Now, there is certain assumption that with more technology, that there will be less human interactions, the less need for human interpersonal interactions. But in fact, the experiences of institutions as well as companies that have deployed more complex technology is that as they deploy these technologies, the demands on interpersonal skills actually goes up. So demand for interpersonal skills, ability to communicate and so forth actually goes up. And in fact, teamwork and shared accountability becomes even more important than before. And in that context, social cultural sensitivity becomes that much more important as well, because different cultures and societies interpret the application of technology in very different ways. Different values, different issues come up, and you have to be very aware, especially in designing that solution, but also in implementing, monitoring, and reviewing that. It also leads to the importance of shared decision making, because technology in its complexity requires multiple groups with different, coming from different disciplines to come to a common understanding and taking responsibility through shared decision making. And throughout this, of course, communications in multiple forms become that much more important. So having had these skills requirements, what does it mean on a longer term for the health workers? Well, we're finding that whenever there is a disruptive technology, that while many jobs may become dysfunctional or defunct and out of date, that new jobs are being created constantly. And we've seen many new kinds of jobs related to, for example, dealing with artificial intelligence in terms of training the program, designing and training the program. AI requires also constant monitoring and evaluation to ensure that it is being utilized properly, with attention not just for the technical results, but also ethical implications. So bioethics has to evolve along. So there's a huge new demand for dealing with AI and related topics. There are all new kinds of bioengineering solutions being proposed. ICT, telemedicine is coming on board, and this is going to be a huge growth area. So many health workers may want to consider expanding So it is often likely that whatever we started out in our 20s, by the time we're in the 50s and 60s, the labor market is going to look very different. The technology is very different. So we need to be prepared to take on different careers now outside of your current profession. So the professional groups right now have good continuous learning programs, yes, medical, nursing, but they're all contained within each profession. And it's very difficult for a nurse to jump to a new career in, let's say, AI design, even though their background as a nurse could be incredibly valuable in designing such new technology solutions. Or if they want to move from nursing to other forms, it's very difficult to be accredited and recognized, and their experience is often not appreciated by other professions. So how do we, as a group, ensure that we can allow for multiple career development over decades and to have options outside of our professional silos? These are issues that will become even more emphasized as the pace of technological advances pick up pace. So this was a very quick tour of some of the issues that we need to think about when we try to find technological solutions to ensure a healthy and resilient and aging society. I hope we'll have a chance to have a good discussion on this topic when we have the webinar. So thank you, and I wish you all a very safe and healthy day. Stay safe, stay home, and I hope that we shall come out of this pandemic stronger than ever. Thank you.
Great, thank you. Apologies for some of the glitches along the way. I'd like to spend a few minutes and open to questions, any comments on what you saw. Afterwards, we will break out into small groups, but we just want to spend a few minutes for your Q&A. Anybody? Yes? Clarence, are you?
Yep.
Sorry. Do you have a question? Please go. Yeah. Or comment.
Just an excellent presentation. Thank you. It's just opened up a whole lot of problems, both with ethics and technology. As you highlighted, as technology advances, our dependence on electricity and other things will also increase. So I liked how you said we had to keep in, if we don't have the technology, what is our plan B? So is there some thought along those lines, like if we have to go little low on technology, and what can we do with, we have diverse countries, we have diverse cultures, diverse socioeconomic status. So how can we keep this in mind while planning something for community?
Yeah.
Thank you.
No, thank you. I know that this was going to be an issue because the new areas seem very costly and infrastructure heavy. But I want to remind you that in many lower income countries, you do have, for example, the use of mobile. Technology doesn't necessarily have to mean high cost, expensive technologies. We need more innovations in low cost, high volume solutions. And I think that's one of the ways forward. So even in lower income countries, how can we use the mobile, for example, technology, which is pretty widespread in many, not all, but many countries. You can think of algorithms and ways in which you can maintain communications. It's not as maybe sophisticated as a smartphone, but just tapping to make sure it's that your elderly is all right, or telemedicine in a simple form, or even community health workers communicating with experts in the capital. What can we do with this case so that there is better interconnectivity? So I think there are many ways that we need to look at, but that is not happening sufficiently in terms of research and innovation. So countries like India or Kenya, others, please, try to think of innovative use of technology to harness, to find solutions. The other thing is that potentially, it's not always the case, but in many lower income countries, you still have the social connectivity. So be very careful not to break that. Be very mindful when you introduce new investments, apartment high rises. They're the worst kind of atomization and fragmentation of the elderly. And so the design, architectural design, maintaining closeness to nature. In many places you still have that. And so how can you make sure that the new investments are not breaking those things down? So it's not just introducing new ways, but also protecting some of the riches and the assets as you introduce new ones. I think these are just some thoughts that come to my mind, but I'm sure there are many other thoughts that you'll have a chance to discuss later. Any other?
Thank
Thank
you.
you.
Sheba raised her
Christine, do you have
hand.
yeah. Sorry?
Sheba raised her hand.
Oh, yes, please, Shiba, and then
Yeah.
Christine. Yeah.
Hi, ma'am. Good evening. Actually, today, as part of this, I was going through something called blue zones. So it is that 5 regions in the world where you get to see a lot of centenarians. And I found it very surprising. They don't have any of this technology or anything. And like you said, back to my own country in India, I think most of the families still we have that joint family system, and we don't believe in putting the elderly people alone, or maybe like in old age homes. Still most of the parents and grandparents are being looked after by us. So I feel that way, even though we don't have very much advanced technology, the elderly people are more safe and more happy to say. But of course, like doctor said, maybe some of the modern places, urban areas, this problem will be there. But I personally, when I went through all the technologies about pet robots and other wearable aids and all that, I thought still above all that we need human touch. But when that is not possible, maybe we can think about, I was reading about that UK e-wall houses where everything is being monitored, even your emotions are being monitored. I am also 55. I am going again looking at my old age. So I thought that is too mechanical. Like you said, just go out, spend some time with the nature. All that definitely will increase our longevity, because that's what is being shown in the blue zones of the country. They all have a lot of mobility, not exercise, but then outburst of walking, and then their social connections, their responsibilities and all that. I think that is more definitely valuable, if not more equally valuable. Thank you.
Absolutely. No, thank you very much. I absolutely agree with you on that. And is it Christine next? We can't hear you. Is your microphone on?
Yeah, I'll try without it. Do you hear me now?
We can hear you. Yeah, it's a bit rough, but we can hear you.
Yeah. In Bolivia, we don't have what they have in India, dreadfully, and there's a lot of problems just with elderly that are left alone. Also, a lot of villages, there are only children and elderly, so the people that have the capacity to care for them are not there. And I hoped and wished when I arrived more than 8 years ago in Bolivia that was different. I thought about that in community thinking, but you have a strong community culture. So I think technology can help and also is already used in the way that Akiko just said, no, that you can give community health workers an instrument to communicate, to help to get access to specialist care or to basic health care, to the healthcare post that is further away. But it will be very important always to analyze the factor, I think, equity at one hand, because if we use smartphones, that's only a small part of the population that has access to it, for example, in Bolivia at least. And also, like you say, she got a personal dimension, because that's very essential that it doesn't disturb that personal relationship.
Great. Thank you so much. Yes. Thank you. Great discussions. But now we'd like to have you go into a small work groups discussion. And I've put a couple of questions forward as to, what, where do you see in your context technology helping or not? And what are the risks, the ethical issues that have to be addressed? If you'd like to discuss those, or you may have other ideas. Hamza will put you in your small groups, and you'll have 10 minutes to discuss, and we'll come back and speak to you on the other side. So thank you.
So we're all from low middle income countries, myself from Sudan, India, Belgium, and we thought that the phones would be an excellent technology. It's feasible. Everyone has a phone at the moment, and we thought there could be some form of also offline applications that could help the patients to get online consultations, or maybe like reassurance or steps they can take before going to the healthcare service. And also we thought that this should be backed up with the community health workers. The problem with technology or phone services, we don't have lines or network in rural areas, but we think this could be feasible or aided by the government governance and policy. Question 2, ethics and risks. We thought there might be a problem with data protection, privacy, and if you'd have any control or autonomy over it. Let's say, okay, I want the services now, but then in the future I change my mind. Would they stop listening to me? Am I 100% sure about that? That's in terms of like high tech technology or whatever. And then we also thought that maybe the risks that comes with this is the issue of globalization and how this could have an impact on, it can strip you of your cultural identity. Like Shiba mentioned, we have very social community and networking and connections and blah, blah, blah. But as there's urbanization, we kind of need the extra help because of how things work now. And that's a down part of globalization. And the third question is, we kind of already answered that. What kind of technology we think, mobile phones, offline applications, and so on. Thank you.
No, thank you so much. Appreciate that. It's great. May I turn to the group with Blessed or Joy? Will either of you like to speak?
So in our group, my name is Joy. Yeah. So we were not very different from what the group with Christine has come up with. We also we looked at Uganda as being a very social country. So some of the technologies might not be readily accepted, but we can start slow. We can start from a lower end, start with the mobile phones, because many people have mobile phones. They're not necessarily smart mobile phones, but they have phones, some kind of phones. So we thought about starting with phone calls, possibly having some programs aired on the different radio stations, even if we could have like a brief moment on each radio station in the different regions that can educate people about the different technologies, so that before we even start introducing the technologies, we can at least have them sensitized and they are aware. So we also looked at the best way, because the best one we could start with is still the mobile phone. And we can, with the consultations as well, we can do them using the mobile phones. And then when we looked at the ethical considerations, we felt, everyone should be able to get the technology. It should not just be for a selected few people. So whatever it is we do, we want to make sure that everyone gets the technology. So just going back a little bit to question 1, we also felt we need to adopt a task shifting kind of model where we can engage even the village health teams or the community workers to be able to implement some of the basic technological related issues, approaches that we would be having in the country. Yeah.
Great. That's great. Thank you. That's really helpful. And group 3 with Abdul Kadir, Dennis, and Clarence. One of you would like to present your group?
Dennis.
Dennis?
Okay.
You're on mute, but Clarence, maybe Dennis is not coming on.
Yes, we did discuss a few things. Said that being from low and middle income countries, you would have a variety of technology available. And it would depend on from simple phones to complicated devices. But the simple phone is something you could count as universal. Almost every household or every person would have one. And this is something that you could link and use. Some of the issues that we thought which would have a problem, when the second question was what would be some of our issues, we thought with regards to privacy, confidentiality, uh, someone hacking into your devices or accessing your data. Dennis was talking about dementia being an issue which, many families don't want to let out and keep it within the family, keep it closed, a closed secret. So some things like this where stigma is associated with the family, these are some of the issues that would be there with regards to privacy and confidentiality being with technology.
Great, thank you. That's critical. You think after
Hey,
HIV/AIDS, you know the
Hello?
problem? Oh, Dennis, great.
Yeah.
Dennis, would you like to add something? Yes.
Yeah, thank you. Clarence covered most of the issues, but we also felt the other issue that he has left out is that we feel that in our low and middle income countries, technology can be applied better to assist health workers improve on the care they give to the elderly, given that in the rural communities, you don't have more of the advanced physicians to take care of elderly problems. Then these frontline health workers can be assisted through telemedicine to improve on the care they give to elderly patients. Thank you.
Great, thank you. That's a very important point. Now to the last group, Sheba or Penelope, either of you like to speak on that? Sheba, go ahead, please.
Actually, we were discussing about the plus and minus side of the technology. So like what our group felt that regarding the cases of developing and underdeveloped countries, we should not give that much of importance to reach to the same extent of technological development like e-wall homes, smart homes and all that. With the existing technologies for emergency, like a mobile phone or a smartphone, they can go for video conferencing and telemedicines. We should concentrate more on social connectivity and structuring communities where they can maintain that social connectivity and they can have the care from the other people. Where in those societies, we need not think about this technological advancing. And the ethical issues, like when I was reading today one article, they said, like not alone smart homes, they can inject you with a chip so that your physical activity, your emotional, everything is monitored, which was very scary for me because personally I would not have wanted to have that chip and getting monitored, even if that gives me some healthcare advances. So ethically, I felt like our group felt that with the existing technology, we should concentrate more on developing communities with more of social support, social connectivism, and mindfulness. That's very important to be our group felt. Thank you.
Yes.
Thank you.
Thank you, Sheba. Penelope, do you have anything to add? Are you okay? Okay. So thank you. I think it's been really critical. I think the use of basic mobile phones is pretty widespread. So I think, how can we use that better? There's a lot, if you with imaginations through community
Hello, everyone.
workers and
That's
others.
about it. That's what we discussed in our group, social cohesion. Thank you.
There we go. Yeah, no, great. And the other thing that we discussed, I think it's important that these advances that's happening in Japan, for example, in a way, they are remedial. They're correcting the fact that we already have atomized, disconnected, lonely, non-family based system. So before you go to, if you have countries that haven't gone that way, be very careful not to go and invest in that direction. So then you wouldn't have to do these remedial, robotic care providers. But how can you design across that? And but nevertheless, many countries, even in low-income countries, you've already gone to that urban situation. So how can we do that? But overall, it is coming, and this privacy issue is going to be so huge that I think we all need to be much more upgraded in our knowledge about that. You think after HIV/AIDS, we've had decades of HIV/AIDS, and still the privacy issue is not addressed in most countries. Maybe more high-income countries, it gets high profile, but even then, with Facebook and other, look at the fights we're having with Facebook and Google. So it's going to get worse. So I think it's all of us. We have to become much more knowledgeable about these issues as we move forward, and particularly with the vulnerable, the elderly is certainly the case, but not only. And I love the mention of has to be equitable, the access to technology. That's another thing that has to be built into how we plan forward. So I'd really like to thank everyone for a fantastic discussion, and look forward to continuing this. There is one more in the series that we have on the Aging Society. Next is about measurements of dementia in a resource limited settings. So that's something that I hope would also be of interest. I'd like to thank all of you for taking time to participate, and look forward to seeing you again soon. So thank you for participating. And anything else, Hamza? I think that covers it all. Okay.
Hello,
Great.
sorry.
Thank you.
Can
Yes,
I ask
yes.
a question? I didn't ask from earlier's presentation. Like, because Japan is very advanced in technology, and I wanted to ask, like, I don't know if robotics have been used during disasters, but I was just thinking, in case of a disaster, would there be a backup plan to the robotics? Let's say there's an electricity blackout, they probably run on batteries, and then they wouldn't be efficient or running after a certain number of hours. Or if there was an earthquake and somehow the robots get injured and they're not working anymore, like, I was just thinking, because robots are not.
I think there's a lot of new things happening, because unfortunately we have so many disasters and earthquakes and flooding, and with climate change it's getting far worse, and with pandemic we have to socially distance. So I would say there's a lot of innovative thinking happening in Japan to deal with it, and some of the solutions are not electrically powered. It's designed, like going down the stairs, it's not a robot, it's just the design. So I think there's a lot that could be done. And they're like putting tents, so families could be in tent inside the gymnasiums and be protected from the pandemic, from the coronavirus. Lots of things happening, and it's not all electricity dependent. Or there are solar panels being set up, and also wind up things.
A lot of innovation,
a lot of stuff there. And I think that kind of innovation, low cost, low energy solutions, there's a lot that can be done. When you think about it, doesn't have to be all this high end. So please encourage your colleagues in engineering and others to work with you on these kinds of low cost, low energy, high tech solutions, high design, let's say high design.
Yeah.
And the other one is also architecturally, how can we get not just these devices, how do you design whole cities, towns in a way that creates a beautiful, it has to be beautiful, because the mind, it helps the emotional well-being of all humans to have a beautiful setting. Even in urban jungles, there are ways through paintings, through design, that you can find moments of solace. So let's be creative. Let's think beyond the usual solutions. Someone
Maeda,
else had
just a quick one. Just a quick one.
Yes.
You talk about three main ways in which technology can be applied. That is resource containment, supporting the elderly, and supporting the healthcare workers. How would one go about trying to see where they can make the biggest impact in their context of all the three? Because you wouldn't want to go all the three. You would want at least to focus on one where you will get the biggest returns on investment. How would one go about answering that question?
Dennis, I would answer you by saying, I had for presentation, I did give lists, but I think thinking by lists there's a risk of thinking tunnel vision. So I would say systems thinking, step back, because everything is interconnected. So every context is different. So I'm not going to say, yes, focus on the elderly per se, because then you tend to forget and become narrow vision. So my response to you is, when you start to make lists, always remember that is the way towards perdition. I mean, we have to do that to communicate, but always remember, don't go into the mechanistic list approach, because that prevents your imagination from working. And the peripheral vision, when you step back, you let your subliminal unconscious mind create patterns, because human brain is pretty powerful. Even AI can't keep up with that in the imaginations that bubble up, good and bad, because biases come up too. But if you can train your mind to think creatively beyond, and suddenly you come up with unexpected inspirations. So even today, people came up with a little bit of outside box thinking, a little bit in this short time. So let's step back, learn to step back and think creatively. And hopefully that'll give you a new sensation of aha, eureka moments. And let's do lots of those, and to share that, because we collectively become stronger when we share these ideas. So that would be my 2 cents worth on that. Sorry, Dennis, I didn't mean to kind of throw this back onto you, but you gave me an opportunity to really say, let's not go down that road in that way. When you start thinking that, you're looking for an easy solution. I'm not saying you are, but I mean, when you go down that road, let's stop a moment and reflect and think creatively. Think emotionally creative, and think beautiful thoughts, positive thoughts, and see what comes out of that. I wish you all very safe and healthy rest of the day, and I hope you all get the COVAX vaccines and so forth. I'm sorry, it's not going very well. We have a long ways to go, but please take care of yourself. And thank you so much for joining and coming together. Really appreciate that.
Thank you. Thank you so much for that, an amazing talk. Thank you.
Yeah.
Bye.
Thank you.
See you again soon. Bye.
Thank you very much.
Thank you.
Thank you so much.